Certainly, here's an overview of colds and flu, including their causes, symptoms, prevention and treatment. Colds are primarily caused by viruses, with rhinoviruses being the most common culprit. They are highly contagious and can spread through respiratory droplets when an infected person coughs or sneezes, or by touching contaminated surfaces. Symptoms include a runny or stuffy nose, sore throat, cough, sneezing, mild headache, fatigue, and occasionally a low-grade fever. Cold symptoms typically last about 7 to 10 days, although a cough can linger longer. To prevent colds, wash hands frequently with soap and water. Use hand sanitizer when soap is not available. Avoid close contact with sick individuals. Practice good respiratory hygiene, like covering your mouth and nose when sneezing or coughing, and of course, avoid touching your face. Treatment for a cold includes rest and hydration. Over-the-counter medications such as decongestants, antihistamines, and pain relievers can also help. Throat lozenges are useful for sore throat relief, and using humidifiers can ease nasal congestion. The flu, or influenza, is caused by influenza viruses, specifically types A, B, and C. These viruses are more severe than those that cause colds. The flu is also highly contagious and spreads in a manner similar to colds. Symptoms of the flu include fever or chills, muscle or body aches, fatigue, cough, sore throat, runny or stuffy nose, and headaches. Some people, especially children, may experience vomiting and diarrhea. Typically, flu symptoms last about a week, but fatigue can linger for several weeks. Annual flu vaccination is the most effective way to prevent influenza, and similar preventive measures as for colds, like hand hygiene and avoiding sick individuals, can also help keep the flu at bay. When it comes to treatment, rest and hydration are essential. Antiviral medications such as oseltamivir may be prescribed, especially for high-risk individuals. Over-the-counter medications can provide symptom relief, including pain relievers and decongestants. And of course, seek medical attention if symptoms are severe or if there are concerns about complications. Key differences between colds and flu. Severity: flu symptoms are generally more severe than cold symptoms. Onset: cold symptoms develop gradually, while flu symptoms can come on suddenly. Fever: high fever is more common with the flu. Body aches, muscle aches are more pronounced in the flu. Complications: both colds and flu can lead to complications, particularly in vulnerable populations like young children, the elderly, and those with chronic health conditions. Complications can include sinus infections, ear infections, bronchitis, and pneumonia, which is more common with the flu. When to see a doctor. Seek medical attention if you experience difficulty breathing, chest pain, severe headache, persistent vomiting, or symptoms that improve but then worsen again. Conclusion vote. While both colds and flu are caused by viruses and share similar symptoms, flu tends to be more severe and can lead to serious complications. Preventive measures, particularly vaccination for the flu, are crucial for reducing the risk of infection. Always consult with a healthcare provider for personalized advice and treatment.